therapy. What is step therapy, you may ask? Step therapy is a commonly utilized approach in healthcare for a wide array of issues. Barring catastrophic situations that warrant extreme interventions, we approach issues with the goal being the most effective and least invasive interventions first. Easiest example to utilize to display this process to me is orthopedic injuries. Step 1. Rule out obvious catastrophic failures that require immediate intervention. In the case of orthopedics, being surgical repairs and casting is two of the more invasive interventions possible. This is often done with diagnostic tests in clinic and basic imaging such as X-ray. After you rule out catastrophic injuries, conservative therapy often includes RICE therapy, NSAIDs, and at-home physical therapy. This often goes for a short period of time, somewhere between a few days to a few weeks, to see if the condition resolves. If it doesn't resolve and you return, we then often step up to proper physical therapy and sometimes a higher caliber of imaging to continue ruling out findings that X-ray may have missed. This step in the process is often an area where we see a breakdown occurring between providers and the patient. Many perceive physical therapy as paying for the privilege of being tortured while not seeing immediate results. This process can take longer and often results in repeated co-pays while seeing physical therapy. So here comes the challenge. If you don't keep this dialogue going with your primary care provider or physical therapist, if you are to stop going to the appointments and fall radio silent, the natural assumption that is being made is that the issue is resolved. This step is also a linchpin for if your insurance will approve further imaging. Often before a prior authorization is obtained for imaging, failure of more conservative therapies are required. Why does this matter to you, you may ask? It matters because breakdowns in this process often serve as the roadblock to getting the care you may ultimately need. And if we fail to prove if conservative therapy can resolve your condition, this often leads to a feeling of distrust between the patient and their healthcare team, because it can feel as though we are failing to produce results and are simply taking your money. Step therapy is in many regards effective to prevent unnecessary waste in the healthcare system and prevent unnecessarily invasive approaches to treating conditions. Step therapy does have a downside though. It can be weaponized by insurance companies to deny coverage of prior authorizations, and this is unarguably a potential shortcoming in the process. Just remember, your provider and your insurance company are not friends. Insurance companies' number one goal is to make a profit by getting the cheapest route to get you off of their back. Primary care provider wants nothing more than for you to get better, regardless of the path taken to get there. Often steps above first line don't result in any significant increase in compensation for your local doctor's office. Please place emphasis in finding a primary care provider that you trust to have your back when dealing with these therapies. If you doubt their motives, it is in both of your best interests for you to seek care elsewhere. Your relationship with your PCB should be one of mutual trust and respect. As a patient dealing with step therapy, what can you do on your side to ensure the smoothest process up the steps? Malicious compliance and record keeping. What is malicious compliance? Malicious compliance is doing exactly as instructed, even if you think it may not be working. Obviously, if you are injuring yourself, don't do it, but as long as you don't perceive the treatment as worsening your condition, continuing to adhere dutifully to the treatment regimen helps your healthcare team build a case against your insurance company to take the next step up in care. I hope that this quick video helps clear up the concept of step therapy and helps you navigate the American healthcare system. Below are some references to things discussed in the video.